Hello everyone, I'm Tushar Pansuria. I'm presenting a case report about acute reversal of systolic dysfunction after A-flutter ablation. Tachyarrhythmia is a reversible cause of cardiomyopathy in most cases. It usually takes 3 to 6 months to improve systolic function after adequate heart rate control. Our case is unique in which systolic function improved within 3 days after A-flutter ablation. Let's discuss our case. This case is about 49-year-old male with medical history of hypertension and diabetes who presented to emergency room with dyspnea on exertion, bilateral leg swelling, and dry cough. His social history was remarkable for cigarette smoking, marijuana, and cocaine. On lung examination, he had bilateral crackles and decreased breath sound. He also had a bilateral lower extremity pitting edema. His vitals showed tachycardia and elevated blood pressure. Initial troponin series ruled out acute myocardial infarction. EKG showed A-flutter. His chest X-ray showed cardiomegaly, pulmonary vascular congestion, and right side pleural effusion. His echocardiogram showed ejection fraction of less than 20%, severe global hypokinesia of left ventricle, severe biatrial enlargement, and normal left ventricle wall thickness. Thoracocentesis removed 800 ml of transudate fluid. His clinical status was improving and his blood pressure was getting better with diuresis and carvedilol. We added digoxin for better heart rate control and warfarin for stroke prophylaxis. His A-flutter was resistant to medical therapy even after 3 days. With help of clinical history, left finding, echo finding, left heart cath, we ruled out ischemic cardiomyopathy, Takotsubo cardiomyopathy, and cocaine-induced cardiomyopathy. We confirmed diagnosis of A-flutter-induced cardiomyopathy. Electrophysiology service decided to do ablation. After successful ablation, we decided to reassess his cardiac function before discharge, and repeat echocardiogram show improvement of systolic function to 40% from less than 20% at admission. So the patient did not require life vest and he was safely discharged home with medical therapy. Studies have shown that it requires around 3 to 6 months to improve systolic function after achieving adequate heart rate control. As per conventional management, patient who has ejection fraction of less than 35% requires life vest for 3 months. However, in our case, ejection fraction improved from 20 to 40% within 3 days of successful A-flutter ablation, which is unusual reversal as per our knowledge and published data. The decision to repeat echocardiogram was beneficiary to our case, and it avoided unnecessary use of life vest and financial burden on him. This case emphasizes that it may be reasonable to reassess ejection fraction before discharge rather than waiting for 3 to 6 months, particularly in case with very low ejection fraction at presentation. Thank you for listening. I hope you found this case interesting and learned a lot. Thank you again.